My name is Bruce Abdullah. I've been doing implants and periodontics for the last 30 years. I've been teaching at the University of Illinois, teaching post-grad residents after they attain their graduate degree and teach them how to do implants. When a patient loses their teeth, what holds the jawbone together, a reconfiguration within the bone, and it creates a stimulatory process to the jawbone. And so when you lose a tooth, the next best thing it would be implants. It takes on the same topography and shape as their natural root, and it simulates them in terms of the stimulation and maintains the ridge architecture. I tell patients the best thing to have is their natural teeth, but if you have to get a replacement, the implant would be your best substitute. It all begins with how much bone we have to work with, and we'll explain to patients that we will only consider implants if the conditions are there or make the conditions favorable for an implant. The foundation has to be there, otherwise we're cheating ourselves in terms of longevity. In all our offices today, standard of care is using a cone beam imaging, and so we start with that process and work the patient from there. And so depending on what they have to begin with, and that gives us a blueprint of the patient's bony architecture. Quite often you don't need an implant for every single tooth that you're missing, so sometimes we could spread them accordingly, and if you're missing multiple teeth, we can do bridges off implants, we can do single implants. We also can do full replacement off of multiple implants. So it just depends on the type of architecture of bone we have, both in the way of thickness, length. We'll sometimes predetermine how many implants to place. Building that footing again and redeveloping that bone. So anything's on the table when it comes to implants. It just depends on how much disease there is, and quite often the biggest factor we have to look at is if there's disease presence, what we need to do to remove disease, not only in the existing site but the adjacent area. So the big picture always has to be looked at. And so when a patient comes in, we have to look at what brought us to this point and try to arrest that before even considering implants. Yeah, so I mean, implants isn't the end-all cure-all. What is the patient's social habits, the patient's motivation to want to keep their teeth and their implants for the rest of their life. And so there is no easy fix. The best way of therapy, ultimate longevity, is just looking at what we need to do to transcend from where we're at today to the future. Yeah. You know, I just say, just be in the best hands possible before you start treatment. Don't go with the easiest path by what you're seeing on television. So educate yourself, ask questions, and know who you're getting treated by before you start treatment.